So there's a concept in gynecology which is known as what? Confidentiality. Alright. So let me just give you guys a gist before we go into confidentiality. Confidentiality is more of like, okay, patient and doctor relationship. How well can your patient trust you with their information? Alright. A patient can even tell you something and say you shouldn't tell the spouse, you shouldn't tell the family members, you shouldn't tell anybody. Well, some of these things, they are actually what levels to keeping those informations. Of course, an information that is at the throwing the whole public into risk, there's subtle ways you can actually handle it. So for confidentiality as related to gynecology, it's just ethical practice, legal obligation. So you're actually trying to protect this patient's private information. Do you understand? You are not trying to you can share the information to relevant authorities, but not to people. So especially sensitive details related to reproductive health, sexual history, gynecological procedures. So it's a cornerstone of trust. All right, how patient actually develop trust between the people giving them this treatment. So why is it crucial? Why is it important? Why is it a thing we actually even look into? So it encourages honest disclosures of symptoms and concerns. All right, reduces fear of stigma, especially around sexual health, contraceptions or abortions. Promotes timely access to care, right, particularly for adolescents and vulnerable populations. Upholds patient autonomy and dignity. So the patient is in charge. The patient tells you what to do and all of that. So for the key principles that have to do with confidentiality as related to gynecology is privacy. So patients have a right to control who can access the health problems they have. Consent. If you want to do something, you should actually always tell the patient, and the patient has to approve first. Security. Records must be protected physically and electronically. Nothing like hacking into database and all of that. So professionalism. So providers must avoid casual or unauthorized sharing of patient details. Alright. So clinical scenarios where it matters is pelvic examinations, STI testings, contraceptive use, adolescent care, abortion services, gender affirming care and all of that. So how is it maintained? So private consultation rooms. When you're talking to a patient, there's nobody here. You understand? And even from this place, maybe where you're sharing that information to be only to maybe your colleagues that basically maybe have something relevant to offer. Limited access to patient database to unauthorized. To authorized personnel. So even your colleagues, not everybody should know. All right. Discuss confidentiality policies during intake. Use chaperones. So sometimes if you are talking on something sensitive, you might ask the patient if the patient maybe has one or two friends that they want the friends to be there and all of that. So this is just what this confidentiality as related to gynecology simply means.